For a lot of us in pharmacy, the word management, well, it can feel like a dirty word, can't it? A distraction from what really matters, taking care of our patients. But what if it's not a distraction at all? What if it's actually the secret superpower that makes great patient care possible? Let's find out.
Right from the very start of pharmacy school, I think many of us feel this pull between two different identities. On one hand, you're totally driven by this desire to help people, to be a caregiver. But on the other hand, you're smacked with the realities of business, and it really can feel like you have to choose one or the other.
I bet this sounds familiar to a lot of you. So many of us have had that moment that, hey, I'm a scientist, not a business person feeling when we're faced with a management course. But what if that's just the wrong way to look at it entirely? So yeah, this is what we're calling the pharmacist's dilemma. How do you possibly balance your passion for clinical care with the day-to-day realities of the job? Let's break down why this tension exists, and maybe, just maybe, why it's based on a false premise to begin with.
Think about the real-world consequences for a second. We have all experienced a chaotic, super stressful workplace. And we've probably also seen a workplace where everything just works. It just flows. A lot of the time, the only real difference is management. A well-managed pharmacy isn't just better for business, it's so much better for the staff and, most importantly, for the patients.
To really get this, we kind of need to understand that the role of the pharmacist has never been a static thing. This need for management skills isn't some new corporate invention, it's actually a return to the profession's roots, just adapted for the modern world we live in.
Okay, so check this out. Back in the early 1900s, pharmacists had to be savvy business people, right? They were managing raw materials as compounders. Then the role shifted to being a dispenser, and those management skills kind of took a backseat. But from the 70s onward, with the rise of clinical pharmacy, that pendulum swung right back. Today's pharmacist is a manager of care, and you simply can't manage care without management skills.
Okay, so if management is so important, why is there so much resistance? Well, a big part of it comes from some pretty persistent myths about business and healthcare. So let's bust a few of them right now.
This is the big one, the myth that being a good pharmacist and being a good business person are somehow mutually exclusive. But really, they're two sides of the very same coin. Think about it. An unprofitable pharmacy can't serve its patients. It closes down. So financial viability is the foundation of sustained patient care. Period.
Here's another myth, that the business side just means cutting corners on quality. But good management isn't about greed. It's about being a responsible steward of limited resources. By managing those resources effectively, you actually make sure that more patients get the care they need. It's not just about cutting costs, it's about maximizing your impact.
And finally, there's the myth of the clinical purist. The idea that you can just focus on the science and ignore everything else. But in the real world, a lack of management skills directly hurts your clinical effectiveness. I mean, how can you give the best care if you can't navigate a formulary or manage your technicians effectively or work within a budget? Management skills don't distract from your clinical goals. They are the tools you use to achieve them.
So, what does management actually mean in practice? It's not some vague, abstract idea. It's a concrete set of tools and processes you can learn and use every single day. So, let's open up the toolkit.
First things first, a clear definition. Management is simply a process. It's about taking resources and organizing them to achieve a goal as efficiently as possible. That's it. It's not about being a ruthless boss. It's about being a smart and effective organizer.
And what resources are we talking about here? Well, every single day, you manage money, people, time, materials, and a huge amount of information. The truth is, you're already a manager. The goal is just to become a more conscious and skilled one.
So how do you manage all these resources? Through a simple, repeatable cycle. First, you plan your course of action. Second, you organize the necessary resources. Third, you lead by putting that plan into motion. And finally, you control, which is really just a fancy way of saying you review your progress to learn and get better. Plan, organize, lead, control. This is the loop that drives constant improvement.
All right, so now that we've busted the myths and we've opened the toolkit, let's get to the ultimate payoff, the undeniable link between good management and better patient care.
And look, this isn't just a theory. The evidence shows that pharmacies that actually engage in strategic planning, which is a core management function, don't just have higher sales, they're also way more likely to offer the clinical services that improve patient outcomes. The connection is direct and it's powerful.
And let's be honest for a second. Look at the challenges facing pharmacy today. We've got an aging population, crazy complex insurance rules, shrinking profit margins, constantly changing technology, and this immense pressure to keep patients safe. Trying to navigate all that without strong management skills isn't just difficult, it's practically impossible. These skills are absolutely essential for survival and success.
So it turns out management isn't a distraction. It's the engine that powers excellent clinical practice. It allows you to turn your clinical knowledge into real-world results for your patients. Which leaves us with one last question to think about. Looking at your own work, whether you're a student or you're a practicing pharmacist, what is one management task, planning your time, organizing your workflow, leading a team member, that you could focus on improving starting tomorrow?